Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning, good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. And today we're going to have so much fun talking about the pandemic and what to do with your business during a pandemic. Now, as we record this, we do pre-record. Sorry, folks that thought this was live. Nope, we pre-record. We're right in the middle of it. We are quarantined. We're self-quarantined. We're told you don't go anywhere, all those various things. But as the program airs, hopefully, fingers, toes, and eyes crossed, we are out of that. But we still need to be learning from what we had to go through these last couple months, because you never know when something like this might happen again. And a big part of it is just being prepared, having your messaging, all of those various things. So that's why this is going to be so interesting today. So please join me in welcoming Lorie Hypnotoad to our program today. Welcome, Lorie.
Hi, Deb. Thanks for having me.
Great. Well, let me tell people a little bit about you, because you truly specialize, but what we're going to talk about really does apply to everybody. So this is going to be great. Mm-hmm. So Lorie Hibma is the owner and CEO of two marketing agencies, CP Solutions and VMD Services, which is Virtual Marketing Director Services. VMD Services works specifically with medical professionals, such as doctors, marketing departments for larger medical entities, physical therapists, orthodontists, and dentists in building a practice that they want through marketing and goal building. Lorie has not only helped medical professionals and physicians establish goals, but to help them build the practice they want, and has worked in the medical arena herself. Lorie is here speaking with us on how the current events have impacted doctors and medical practices across the nation. So again, Lorie, welcome.
Thank you. Thank you. It's nice to be here. I've listened to quite a few of your podcasts. I'm very excited.
Great. Thank you. Thank you. Well, it is today, these are challenging times. And as I mentioned, hopefully we're coming out of the pandemic. We're able to deal with things. But the problem is we didn't plan well to start with. We never saw it coming. And so the key is that whether we're done with it, whether we're still in the middle of it, or whether it's, whatever it is, there are so many things that we need to do to plan ahead. So let's go just backwards a little bit in time. Tell us how it is that you decided that this is your passion in life.
Well, that's kind of a funny story. I actually worked in the medical arena. I've actually worked in a couple of different doctors' offices through my career. I've worked in a chiropractor's office. I worked in a physical therapist's office, and I worked in a podiatrist's office. So I've had different roles within the medical arena a couple of different times. Most all non-clinical. I am not when you're dealing with a doctor's office, you have what they call front desk and back desk. I was never back desk. I actually don't like blood, so I'm not clinical. Although in order to be a part of a physician's office, you do have to understand the clinical.
You have to speak that language.
Well, and you even have to know some of it. You have to know how to react in the case of an emergency. So I have a little bit of a background there, but it's not my first passion, that part of it anyway. But I got started with marketing a medical practice when I was working with a group of physicians, and they just needed somebody to help build their practice. And as time went on, their needs changed, and they weren't looking to build their practice as much. But at the same time, I had really come to love marketing a medical practice, and really, it's extremely rewarding in some ways that other marketing isn't, because you're bringing people in who need help, and you see them get help, and then they go. So it's like, it's very Whereas a lot of in the other marketing fields, you
Mhm.
don't get that. You don't
Right.
get that immediate
Mhm.
satisfaction of seeing somebody, hey, I need a doctor. Oh,
Mhm.
here's my doctor. You should come see them.
Mhm.
Oh, that works great.
Wow.
Thanks.
Mhm.
Yeah, you don't see that happening.
Mhm.
And sometimes you definitely don't see that happen over the course of
Mhm.
just a couple days
Mhm.
in the marketing world. Sometimes that takes months, right? Campaigns take a long time
Mhm.
sometimes.
Right.
So yeah, so that's how I kind of got started. And then I decided I'd always worked through my children growing up, and I decided that with my daughter, she was 3 at the time, I wanted to be home more.
Mhm.
And I had just finished my degree in IT with an emphasis in multimedia. And so I was developing websites from home, and
Mhm.
just it was right when all the digital marketing started to really
Mhm.
take off.
Mhm.
And I had a couple people drop the one person specifically said, I don't understand why you are working for somebody else. You should be doing this
Mm.
on your own.
Ah.
And those are dangerous seeds to plant in
Mhm.
people's
Right,
heads.
right.
So that's what I
Mhm.
did. I started doing it from home on my own, and
Mhm.
then I got connected with a business coach that worked specifically in a couple of in
Mhm.
one different industry, and that led to me being introduced to other coaches and
Mhm.
other industries. So it's just kind of taken over, and now we're seeing different people within the
Mhm.
health industry in about six or seven different niches. So
Mm.
it's really cool. Really
Great.
like it. I started at the kitchen table. The idea
Mhm.
was to just do a little here and there, and now we are at a team of over 20.
Wow.
So yeah,
Nice. Nice.
yeah.
And it's interesting because we don't often think of medical people,
Hmm.
physicians, whatever, as advertising.
No, right.
And so that's got to be one of the first challenges is, because I think a lot of times they think, well, they will just come to me. I'm the best whatever in the world. They'll come to me, they'll refer to me. Other
Hmm.
doctors will refer to me. I mean, all these various things.
Hmm.
And they don't stop to think, I need to get my own message out there. So when
Right.
you have somebody that's come to you and said, really, do I need to market, Lorie? What do you tell them?
Are you seeing the patients you want to see?
Mm.
It's really simple
Mhm.
because regardless of what type of doctor you are, a primary care physician or a specialist, there are certain types of patients that you gravitate towards.
Right.
Maybe even a PCP.
Mhm.
There are
Mhm.
certain patients. My PCP here in Michigan, I know for a fact that he prefers to see middle aged. He's not real super fond of small
Mhm.
children.
Mhm.
Not saying that he won't see them,
Right, right.
but they all have a certain patient
Mhm.
type that they
Mhm.
like to see the most
Mhm.
of. Of course, there's also the profitability,
Mhm.
right? Certain patients can be extremely expensive to see.
Right.
Do you have the staff to see certain types of
Mhm.
patients? That's another. So what are your resources? What's your
Mhm.
bandwidth within a medical practice?
Mhm.
So it's not it's more than just I'm going to hang out my shingle, and because I'm a doctor, they will come to
Mhm.
me. And then of course we have things other factors like bedside manner.
Mhm. Right. Oh, yeah.
And some doctors really, quite frankly, need help
Mhm.
because their bedside manner, that's just not who they are. They're
Right.
very factual, they're very
Mhm.
clinical. And so they struggle
Mhm.
with finding the patients that are okay with that and
Mhm.
aren't looking for that, somebody who's going to
Right.
spend an hour to sit and talk to
Right.
them. So yeah, everybody has a perfect patient that they need to see or want to see,
Mhm.
and there's a lot of factors that go into that. So as soon as a doctor says to me, well, do I really need to market? That's one of the first questions I
Mhm.
ask them as well. Are you profitable
Mhm.
in your practice? Are you seeing the patients you actually want to
Mhm.
see? Are you seeing the patients you should be seeing based on your community and your demographic?
Mhm.
And you know, are you helping them?
Right.
So there are definite,
Mhm.
definers there.
Right. And then unfortunately, there's also society's impression that they
Hmm.
shouldn't be advertising, that that's tacky, that takes advantage. And it's funny, we were talking before the program about advertising during a
Hmm.
pandemic, especially medical.
Yeah.
There are certain things that you have to be very careful with. Years ago, I worked for the American Cancer Society, and we had to be very careful with our marketing, that especially when we were using patients and survivors
Right.
to tell our stories, because we never wanted people to think we were taking advantage of them.
Right.
Both the people that were helping us and the people who
Right.
were hearing the stories. And it was tricky. I mean, because you didn't want somebody thinking, oh my gosh, they found the worst patient in the world, the most sick or the
Yeah.
most sympathetic or
Yeah.
whatever, just to draw at our heartstrings.
Mhm.
But at the same point, you needed those type of people to say, hey, this is what I've been through, and so that's where I would imagine it is a little difficult for people in the medical profession to not seem like they're taking advantage of somebody.
Yeah. Yeah, and I mean, I think that's something most of the doctors I've talked through, they're working through that,
Mhm.
or that, I don't know what you want to call it, but that impression is
Mhm.
something that once they've been in practice for a while, they kind of get over it.
Right. Right. Mhm.
They have to, you know what
Mhm.
I mean? Because they're not, and you're not. You're going to make sure your message isn't opportunistic,
Mhm.
especially like in times of now, the
Right.
pandemic, everything else. You're going to make sure that you're
Mhm.
not you're not being opportunistic. I
Mhm.
mean, that's definitely. I don't know any of the doctors that we work with that I would say are that fall into that
Mhm.
category. They really truly do care about
Right.
people, and that's why they're in the. I mean, you
Mhm.
got to think about what they have to go through to
Mhm.
become doctors. If they
Right.
didn't care about people, would they really go through
Right.
all that?
Oh yeah. Yeah. I mean, you've
No.
got people, what, they're
Yeah.
making lots of money.
Yeah.
Maybe.
Maybe. I'm like, I'm not sure. I know a lot
You
of
have a
very
lot of
busy
loans.
doctors, and
Yeah.
there's a
Yeah.
lot of debt
Mhm.
that goes into
Mhm.
being a physician. I don't.
Right.
I would challenge people when they
Mhm.
say, "Oh well, doctors just make all this money."
Yeah.
There's a few that
Mhm.
probably do, but
Right.
majority of them don't fall into that category.
Well, and those that do, for the most part, have,
Hmm.
as you said, they have earned that right. They have worked very, very hard,
Yeah.
as you
Yeah.
do in any profession.
Right.
And granted, there are definitely certain types of doctors that are able to
Hmm.
charge more. That's
Yeah.
just, by what they do. And it could be in who they serve, some things like that. Plastic surgeon
Hmm.
is something that comes to mind with that. There are plastic surgeons who do, shall we say, the glamour type of
Hmm.
things,
Right.
which we're not saying that's not needed. Somebody might argue it's not necessary, but there's certainly people who think it's very needed, and they might pay a little bit more for that service.
Right.
But of course, there are also so many plastic surgeons who are at the other end of the spectrum, who are helping,
Right.
with people who have scars, who have,
Hmm.
all sorts of things. And I mean, they're just barely scraping by. So, it's like with
Yeah.
any industry, any profession, you're going to have those at one end and those at another end.
Right. Right. And that does happen. I mean, obviously.
Mhm.
But not everybody shows up on TV. That's the one
Right.
thing I wanna,
Yeah. Yeah. I mean,
I'm like,
that's the thing is,
that's part of the
yeah.
impression people get
Yeah.
is he's
Not
on
everybody is
TV
Dr.
and
Oz.
right.
And
Exactly,
yeah,
exactly.
right. And again, that's, I mean, that's like with certain professions, you have those who gravitate
Mhm.
towards being that celebrity, that media, that whatever. And that was part of maybe why they decided to go into this.
Right,
Whatever that industry is they wanted to be a
right,
spokesperson or whatever.
right.
Um,
But that's very rare.
Right. Oh yeah.
Very
I mean,
rare.
yeah. I mean, if you look at the percentages,
Yeah,
it's a very, very small percentage.
yeah.
But as I mentioned at the start of the program, as we're filming this and as we're recording it, we are
Mhm.
right in the middle of the pandemic,
Yeah,
and so many people would think, "Well, doctors must think this is the greatest thing in the world." It's actually the opposite for them.
correct.
Um, you know, in a variety of ways. I mean, we all know there's supply shortage. There's all sorts of things, but the thing that is the one of the things that I think so many people don't understand is there are so many doctors who, a patient visit could wait. you know
Right,
and
right.
and you know and I was mentioning to you before the program that I was to see a new doctor, and they called and they said, hey, it's going to be a virtual appointment. I'm like, really? You don't have to see me?
Mhm.
I'm a new patient.
Yeah,
And and there are obviously a lot of things that we go to a doctor for that can wait.
Mm-hmm.
But there's a lot of other things that have to be seen right away. And when there's a pandemic, things just, I mean, the rules are gone. They're
Right.
just
Oh yeah,
completely gone.
everything changes.
Mhm. Right.
Yeah.
So, when you're working with physicians, and I,
Mhm.
it really is something that I think every industry is facing. I was talking to somebody earlier today who is in the flooring industry, industrial floors, who
Okay.
is facing
Yeah.
challenges with all of this, because what they do is still needed, but the
Yeah.
place they need to be is closed,
Yeah.
or all these various things. And so, when you've got it now, let's just be upfront. Doctors are a necessity. Yeah.
Yes,
they're,
they
they're in that
are.
line that they're a necessity. And so you wrote this great blog post, and it's got several different really
Mhm.
good tips in it. So let's just kind of go through some of those.
You bet.
What do you tell doctors when they're saying, oh my gosh, Lorie, we don't know what to do?
Yeah. Well, I mean, the first thing is they have to remember who they are, right? They're physicians.
Mhm.
Their patients are counting on them,
Mhm.
not just to relieve physical symptoms.
Mhm.
Their patients, in fact, there's a study that came out from, oh my gosh, I think it was, I'm not even sure now. I remember referencing it this summer in
Mhm.
a conference I spoke to, but there is a study that came out that basically said the mental angst or the
Mhm.
fear of the unknown is probably one of the
Mhm.
biggest
Right.
issues that patients have.
Mhm.
And so the first thing that we're telling our doctors is, hey, you've got to stay calm. If
Mhm.
you panic, you are actually somebody that
Mhm.
that society or community is
Right.
looking at. You have the ability to help them fight their fear,
Mhm.
right? And fear is a huge thing. So the first thing we're telling our doctors is stay calm.
Mhm.
Understand who you are, understand the role you play in your community,
Mhm.
and move forward. Now, there are a lot of different things they can do in that process
Mhm.
as far as building their
Mhm.
practice. You know, I have one doctor who needed to remodel his office and had been too busy. He couldn't get the office
Mhm.
remodeled because he never
Right.
had enough
Now's a
downtime.
good time.
He's remodeling
Mhm.
his office right
Mhm.
now, and that's for the best. That's for
Mhm.
the best of his patients. He just needed new things.
Mhm.
So there are certain things that the doctors can do, and
Mhm.
they can stay calm and they can show their patients that they are continuing on. So
Mhm.
that's the first thing.
Mhm.
Um, they need to keep marketing. And I know that
Right.
people who
People are
aren't
like,
marketer,
no, no,
yeah,
too
yeah.
much going on. Let's not market.
Yeah, and that's actually just really the wrong message.
Mhm.
Again, this is the message should change.
Mhm.
Okay, like,
Right.
don't be marketing something that's irrelevant. Don't
Mhm.
be, telling your patients that, they need to come in for something frivolous,
Right.
right? That isn't
Mhm.
absolutely necessary.
Mhm.
But keep marketing, but
Mhm.
make it relevant. So
Mhm.
change the message. Keep
Mhm.
your marketing going, but change the message and make
Mhm.
sure that what you are marketing is absolutely
Mhm.
relevant to the area of specialty that you're in.
Right.
um, Update your digital
Mhm.
content, right?
Right. Mhm.
Pay attention to some of these things that you haven't been paying attention to. We're telling our doctors, and you as a marketer, we're telling people all the time, do more video, do more
Mhm.
video. Okay,
Mhm.
well, guess what? You now have
Mhm.
time to shoot video.
Right.
So
Right.
shoot the video.
Mhm.
Update your content.
Mhm.
Be a part of social media. Be a community, uh, influencer.
Mhm.
They have the ability as physicians to be influencers
Mhm.
in their community right now. And what they do with that, there's that saying, with great power comes great
Mhm.
responsibility. If
Mhm.
you're a Spider-Man fan, but
Right.
I'm like, you have great power now
Mhm.
as a physician. Even if you choose to close your office,
Mhm.
you still have great power. So
Mhm.
use that, and be an influencer in your
Mhm.
community for the best.
Right.
Update your
Mhm.
patients on a regular basis
Mhm.
using Facebook, Instagram,
Mhm.
TikTok, things like that. Have some fun with your patients if you can via
Mhm.
video. Don't, you have to be careful. There's HIPAA and a few other
Oh
things like
yeah.
that
Yeah.
around.
Mhm. Yeah,
you
you can't be disclosing patient names, all those things that you
Right.
can't do anytime. So, just
Right.
keep those in
But
mind. Mhm.
Right, but you can do Facebook Live events, and if somebody chooses to be a part of a
Yes.
Facebook Live event, you're not
Right.
violating
Right.
HIPAA there, because that's a
Yeah. Because if they ask the
patient's making it.
question.
Right, that's a choice the patient's making. So
Hmm.
you're not violating HIPAA there. So
Right.
you just be careful. You don't use their name. You say, "Oh, great to see you. See who's joining. Nice
Hmm.
to see you."
Hmm.
It's up to them to disclose more
Hmm.
than what they want on that.
Right.
Make sure you, like I said, update your blog, your social
Hmm.
media. Keep an eye on the metrics. It's extremely
Hmm.
important. Every doctor should always be watching their number. They should know, what kind of patients am I seeing, and am I
Hmm.
still hearing from?
Hmm.
You know, we work with a lot of podiatrists, and so right now your diabetic patients, just because they
Right.
shouldn't come into the office
Hmm.
doesn't mean that they don't need help.
Hmm. Right.
So there's a lot of things. So be paying attention to
Hmm.
some of your metrics, and to some of your really extremely precarious
Hmm.
patients, right?
Right.
Because they still need help, a
Hmm.
lot of help.
Right.
And then the last is to just really stay current. In fact,
Hmm.
today even we just got informed that the Centers for Medicare and Medicaid Services, so CMS,
Hmm.
just basically, it literally just came out less than 6 hours. Are They've issued waivers for certain requirements for hospitals and healthcare systems,
Hmm.
specifically to help manage this
Hmm.
crisis.
Right.
They're increasing hospital
Hmm.
capacity. They're the purposes behind it are huge. And so
Hmm.
what they're doing is Medicare and Medicaid they're taking some of their restrictions, because they usually have very tight
Right.
restrictions.
Hmm.
They're lessening some of those
Hmm.
restrictions so that more people can get help.
Hmm. Right.
So, stay on top of things
Hmm.
like that. That's a huge thing right now,
Hmm.
is what are the provider requirements that are being
Hmm.
waived by the CMS due to
Hmm.
COVID-19. So those are things that you've really got to be paying attention to.
Right. Well, and knowing, is this a temporary change,
Right,
or, is it something that we're going to have to continue to deal with?
right.
And especially with guideline changes and rule changes and
Yeah,
things like that. There's so many different things. It might be that, in this instance, you have to have two people review it, and now it's one person. Okay, is that going to
correct.
be, is that something that's
Yeah.
going forward?
And that's
Some.
one of the things they did change, yes, is their
Mhm.
review policy.
Hey, what do you know? I just totally made that up. But it is important. I was talking with somebody else earlier today who was talking about things that need physical signatures, a true
Mhm.
person. And they said that in some places they have now changed the guidelines, the rules, the laws, the
Yep,
whatever it is, to say, okay, no, an e-signature does work.
right,
And now that might go back. I mean, and that's the,
right,
you have to remember, okay, well, as of X date, no, you have to go back to signing everything. So,
right.
it's very important to keep tabs on those changes.
Right, exactly, definitely, yeah. And there are some changes that doctors can be making right
Hmm.
now, that they can continue after this crisis.
Hmm.
So, I know one of the things that we hear from some of our physicians and our groups is that, well, I don't want to put a lot of time and effort into this because it's all going to be over in 6 weeks.
Right.
And my point to that is, yeah, but this could change.
Mhm. Right.
So this could change the face of
Hmm.
it forever.
Hmm.
This,
Right.
I think that we're at a very pivotal
Hmm.
point, at least I believe so. I think
Hmm.
we're at a crossroads. I think we're
Right.
going to see some differences in the way we practice, in the way our
Hmm.
doctors practice medicine, but also in the way as a society we want it to be done.
Right.
So there's
Right.
two
Hmm.
pieces to that.
Hmm. Yeah.
But yeah, so there are a bunch of different things that our
Hmm.
healthcare providers can do right
Hmm.
now to prepare for what this could look like afterwards.
Right. Yeah. Say, for example, they start doing a weekly video.
Right.
There's nothing that says 2 years from now they shouldn't still be doing a weekly video.
Right.
And just because they have downtime right now, which some of them might, depending on
Mm-hmm.
their specialty, it is the time to be doing things, and be learning
Yeah.
those new skills and things. And if you're in the front line, well, then maybe you really
Yeah.
need to be looking at things. Okay, what can we change?
Right.
Is there a way that we can do more virtual type of things?
Right. Right.
Do patients that really aren't critical need to be coming in? And how do we
Right.
communicate with them so that they know that we still care about them? We still want
Yeah.
them to come in, but right now is just not the right time.
Right. Well, and there are 5 things specifically that we're referring our physicians to think
Okay.
about when they're talking to us and they're
Hmm.
asking us like, what do we do right now? What
Right.
can we do? And I'm like, well, one of the things, first thing is if you are somebody who still needs to see patients
Hmm.
and should be seeing patients, or
Hmm.
maybe you should be, even though you're not considered a critical
Hmm.
care provider at the time, but telemedicine,
Right.
right?
Oh yeah.
Telemedicine's
Yep.
it started, it's
Hmm.
become bigger, and now, especially with the CMS lifting their ban,
Hmm.
now Medicare and Medicaid are going to pay for that.
Wow.
So
Hmm.
yeah, that's huge because
Hmm.
Medicare and Medicaid wanted nothing to do with
Right,
that.
which is understandable because
Yeah,
you can't monitor it. I mean, there's so many reasons
there's a
why,
lot of restrictions,
doing
right?
something like what we're doing right here is just tricky.
Yeah, yeah. So telemedicine is one of the things. Valet medicine, and there's a
Hmm.
difference between valet medicine and concierge medicine.
Mm.
Valet medicine is what I call, or we're calling it with our physicians, door-to-door service,
Okay.
meaning your patients drive to your office,
Hmm.
they stay in your car,
Mm.
somebody comes out and gets them, walks them through a specific door,
Huh.
they see the doctor, and then when they leave through a different door. They're
Hmm.
never in contact with anybody but the
Mm.
doctor and a single staff
Right.
member.
So if you have
Um,
a practice that continually has infectious type of patients, that's
mhm.
perfect.
Or patients that are at risk,
Hmm.
right?
Right. Oh
So,
yeah. They might not be. It's not a good thing for them to be
mhm.
around other people.
Right, right. So we're calling that door-to-door service or
Hmm.
valet services. Some doctors are calling it drive-up services. We have one doctor who the building that they have actually used to be a bank.
Ah.
And so they're seeing people through the drive-up window, which I
Right.
think is
Hmm.
brilliant. I mean,
Hmm.
they took
Hmm.
what they had and they built off of
Hmm.
it. Another option is what they call concierge medicine. It's
Hmm.
also known as direct primary care medicine.
Hmm.
And basically, what it is typically that's a concierge medicine is where you pay a retainer, right?
Right.
You're going to pay
Hmm.
a monthly fee, and
Hmm.
for that, you get things that like private appointments and
Hmm.
house calls, and
Hmm.
it's definitely a concierge. But
Hmm.
again, if you're one of those people that's at risk, that's not such a bad thing.
Right. Or maybe
And
you
there
just
are,
don't drive or,
yeah.
whatever. Hmm.
Hmm. For doctors that are, another thing that they're doing is for doctors that carry supplies in the office.
Hmm.
So some doctors carry, if you have an injury, they carry, you know, braces
Hmm.
or different supplies in the
Hmm.
office. Some of them are doing door-to-door delivery. Like
Wow.
after a
Hmm.
telemedicine conference,
Hmm.
they actually have somebody that they've hired,
Hmm.
usually a staff member, who
Hmm.
will take up the supplies,
Mm.
take them to the door,
Hmm.
leave them on the door,
Hmm.
ring the doorbell, stand back 20
Right.
feet, wave at the
Hmm.
patient, and
Yes. Make
leave.
sure somebody goes out and gets it. Hmm.
Right. So door-to-door
Hmm.
delivery.
Right.
And then there's others who, we have doctors who their patients relied on public transportation,
Mm.
and you're not doing that right now, that's
Hmm.
for sure.
Right.
And so staff members, they're going and picking them up.
Wow.
Yeah.
Hmm.
They contacted
Hmm.
their insurance companies, had additional insurance put on the
Hmm.
vehicles,
Hmm.
and staff members are now going and
Hmm.
picking people up who relied on public
Hmm.
transportation. So those are just some of the things that we're seeing in the middle of the pandemic
Hmm.
that I think we really can encourage our doctors to consider
Hmm.
even beyond the pandemic.
Hmm. Right. Right. And of course the key to all of this is communication.
Right. Oh,
You mentioned
yeah.
a podiatrist, so
Yeah.
somebody might, say a diabetic has
Yep.
an issue with a foot.
Hmm.
And they're thinking, well, but I've been told I'm not supposed to go out,
Right.
all these various things. But the podiatrist is like, you still need to be seen for this. Now maybe
Oh,
it's
yeah.
and so I
Wounds,
think that's one of
diabetic
the,
wounds.
wound care, things like
Terrible.
that,
Oh, yeah.
or people are just thinking, it's just a stuffy nose, it's just whatever. And
Yeah.
I actually was talking to someone the other day who said they were not going for what would be normally a required medical treatment
Yeah.
because the governor had said, no, you're not supposed to go out. And I'm like, okay, the governor doesn't get to say that you can't have that treatment.
Right. Right.
And that of course was not what the governor was saying. But
Right. Right.
it's like, okay, well, you just don't go, you still can go for
Right.
your treatment. But that's where the doctors need to be coming in and saying,
Mm-hmm.
whether it's the doctor, the staff, or whoever, picking up the phone and
Yeah.
calling and saying, hey, Lorie, we see you've got an appointment on Thursday. It's very important that you still keep that appointment.
And here's how we can help you
Mhm.
keep it.
Yeah. What can we
And
do to make sure you keep it?
yeah, here's what we can do to alleviate your concerns about coming into the office.
Right.
There's a lot of that messaging that needs to be massaged and
Mhm.
changed.
Mhm.
And a lot of that's going to require training with the team, with
Right.
the people
Mhm.
who work for the doctor. What can the doctor do to help their staff
Mhm.
becomes
Mhm.
one of the next questions then,
Right.
because, okay, so am
Mhm.
I putting my staff at risk?
Mhm.
And, so one of the things we say to people is, okay, first of all, the doctor needs to consider their staff,
Mhm.
right?
Right.
Safety
Oh,
first
yeah.
and foremost,
Mhm.
beyond anything for your
Mhm.
staff. But the staff also has fears that they need to
Mhm.
calm. So the staff needs to be educated. They need to
Right.
know how to answer the phone, what the
Mhm.
message for the person
Mhm.
answering the phone is going to be. For doctors who have voice over IP,
Mhm.
if they have a voice over IP system, the phone can be taken to the staff member's house. They don't
Mhm.
even have to leave the house
Right.
to answer the phone.
Mhm.
They can answer the phone at home.
Mhm.
The doctor can have them virtual in through a
Mhm.
computer so that they're still maintaining HIPAA policy and privacy.
Mhm.
They need to take the right precautions to
Right.
do those things, but they also need to understand that that still becomes a critical resource
Mhm.
for their patients and for
Right.
their staff. And now
Right.
their staff is still employed.
Right. Oh, yeah.
That's
Yeah. It
that's kind
wasn't
of a
just
big deal. Yeah.
sorry. And of course, one of the things now is that so many people are having their kids at home,
Oh,
and
yeah.
homeschooling and doing things like that, things that they
Yep.
had never planned on. So, you might still want your staff to come in. Well, they might not
Hmm.
be able to, so are you going to, and again, this, it's not just medical practices that this is dealing with, this is
Right.
across the board. How can you work with your staff so that they're able to be home, to be working with their kids, taking care of their kids, but
Hmm.
still earning that paycheck?
Right.
And I mean,
Yeah.
there was somebody on Facebook the other day who posted, well, because I couldn't go in, I was laid off.
Yeah.
Now, I have
Now that's
no idea what the job was. It could
right.
be that they needed to have a true physical presence in wherever they were.
Yeah.
But yeah, I was like, okay, could there have been a way to have worked differently with them? Maybe it's just adjusting schedules,
Yeah.
medical billing. Okay, you can do it at 10 o'clock at night.
Yeah. Yeah, exactly. You
And,
don't need to
some
be in
things,
the
right.
office at the same time everybody else is. And can you make that shift?
Mhm.
And does the area you're in even allow you to make that shift? I mean,
Mhm.
I know
Right.
here in parts of Michigan, if you're out on the road, you're ticketed. So
Mhm. Right.
you have to be able to work
Mhm.
around that. And
Mhm.
I think it's critical that our doctors do that for their
Mhm.
staff, because if they don't have staff, they can't take care of the
Right.
patients. And if we can't take care of the patients,
Mhm.
we're never going to get through the pandemic.
Mhm. Right. Well, and at some point, we're going to go back to normal. Now, I
Yeah.
think normal will
Hmm.
have changed. But,
Hmm.
and so there will be some places, and again, doesn't matter if it's a medical office or whatever, that will think, well, we don't need all this staff. Or
Right.
these people can work from home, or this works different, things like that, which I
Right.
think is going to be pretty cool to see
Hmm.
how things have changed and how things have adapted. But, now is kind of the trial period for all of this.
Right, exactly. Yeah, it is. I mean, right now the doctors need to be planning ahead.
Hmm.
So how do you plan ahead? How do you ensure
Hmm.
that you have a medical practice to return to in a
Hmm.
few
Right.
months?
Hmm.
How do you ensure that you're going to stay in business?
Hmm.
How do you ensure you can
Hmm.
continue to bill
Hmm.
insurance companies for charges?
Hmm.
So there's a lot of things that our doctors can be doing
Hmm.
to help plan ahead.
Hmm.
Again, I think it's critical. The first thing the doctors need to think about when thinking about planning ahead is patients are going to remember what doctors were there for
Hmm.
them
Right.
and which ones weren't.
Hmm. Hmm.
So when all of a sudden you can go to a doctor's
Hmm.
office, if your doctor is the doctor who closed their doors and felt you were left
Hmm.
struggling to get
Right.
care,
I was
whoever
stranded. Hmm.
yeah,
Hmm.
whoever they end up going to and getting that care from is who
Hmm.
they're going to return
Hmm.
to
Yes.
when this is done,
Hmm. Right.
because you're going to remember that. You
Hmm.
remember the people who are there for
Hmm.
you and you remember the
Right.
people who aren't.
Right.
That's just
Well, and we
normal.
we do that no matter what.
Of
If
course.
I need an appointment at Thursday at 1 and my doctor says, I'm sorry, I don't see patients Thursday at 1, well, then I go find a doctor who sees patients Thursday at 1.
Correct.
You know, but what I tell people is couldn't see me.
Mm-hmm. Yeah. Yeah.
And you know, and I don't, there's no explanation, there's no, you know, and so then people go like,
Mm-hmm.
well, then I don't want to go to that doctor either because they can't see me. You know, and
Well, or doctors whose phone, they're just not answering their phones now.
right.
That's
Mm-hmm.
I think that's one of the, from a marketing perspective, it's probably one of the most frustrating things for
Mm-hmm.
me. You can have a phone number forwarded to a cell, for crying
Right.
out loud. There's
Mm-hmm.
no reason
Mm-hmm.
for a phone not to be answered
Yep.
right now.
Oh yeah.
And we have so many people, especially amongst our elderly, that are scared.
Mm-hmm.
And
Right.
sometimes
Mm-hmm.
all they need is a phone call. They
Mm-hmm.
don't need to see the
Mm-hmm.
doctor. They just need to know, you know, like some of their questions. Can I
Right.
take this medicine
Mm-hmm.
right now? Should I
Yeah,
be
I've
taking
heard
this
that I'm not supposed
medicine?
to take this. That makes it worse,
Yeah.
or you know.
Yeah.
Um,
Yeah. I'm not supposed to take ibuprofen.
mm-hmm.
You know, so having a doctor,
Mm-hmm.
if they're really wanting to ensure that they're going to have something
Mm-hmm.
in the future,
Mm-hmm.
that's the very first thing they should
Right.
do. Is they actually need to help with the mental angst that a
Mm-hmm.
patient's feeling,
Mm-hmm.
as well as not just the physical symptoms.
Right.
They need to address both the physical and the mental, and go from there. I mean,
Mm-hmm.
that's huge.
Mm-hmm.
You know, there's some other things too, Deb, that they can do. If their office has been an office that's been, say, kind of in the middle of a, well, let's just say practice management issue of
Mm-hmm.
any kind,
Mm-hmm.
maybe it's a staffing issue, maybe it's a
Mm-hmm.
protocol issue, maybe it's a billing issue. Well, now's the time to get it fixed.
Right.
Crack down on that
Mm-hmm.
stuff, get it fixed, get it
Mm-hmm.
working. There are other practices that are struggling. You know,
Mm-hmm.
we have one doctor, unfortunately, they hit their own health crisis prior to the pandemic, and they couldn't see patients now if they had to,
Mm-hmm.
which is scary.
Right.
So, you know, one of our advices to them was, well, what about is there another practice in the area that sees the same types of
Right.
patients you do? You have the same specialty that they can, that
Mm-hmm.
you can reach out to and say, hey, can you fill in for my
Mm-hmm.
patients?
Right.
And then communicate that message to
Mm-hmm.
the patients.
Right. You know, and you might lose them forever, but
You might, yeah,
you know,
or you might keep them.
mm-hmm. Yeah. Yeah. Or
Yeah,
that doctor, you know, when things go back to normal, might start referring back to you.
right.
You know, and because
Yep.
you know, it's like you said at the start, there are patients that doctors click with,
Yep.
patients that they don't, you know, and so it's great to be able to send the ones that you don't to somebody else.
Yeah.
You know, one of the things that you mentioned that I thought was interesting is being that resource. It's funny. I've heard twice now, 2 different ads on, you know, TV, whatever, about insurance. Well, one is State Farm. I'll just, you know, put it, State Farm is one. And then another was another insurance company where they flat out said, we can help you with whatever you need.
Yeah.
And I thought, really? So, you know, if I'm having trouble paying my mortgage, I should call State Farm. But then I saw something else, and it
Yeah.
said that what they're doing is they're so well connected in their communities that they might know then who to refer you to. So it
Right.
wasn't that the State
Yep.
Farm guy is going to say, okay, I'm going to write you a check and pay your mortgage. It's that they might say, here's a resource we're going to refer you to.
Right.
And, you know, and I liked that concept of, you know, I'm not going to try and sell you insurance right now, but I'm going to be so helpful that when you
Right.
need insurance, you're going to remember me.
Right. I mean, for instance, I have friends right now that are doing food pantries, and they're
Mhm.
doing, I have other friends who are sewing masks,
Right.
and it's one of those things where,
Mhm.
you know, even for my own team, who I've
Mhm.
got them working from home, but, you know, this morning on our staff meeting, I
Mhm.
said, okay, so who needs masks?
Right.
How many do you need?
Mhm.
Do you need 5? Do you need 10? Has your
Mhm.
family got them? Who needs groceries? Who
Mhm.
needs water? Who needs toilet paper?
Right.
You know, who would have thought 2 months ago
Mhm.
we would have been worried about
I
toilet
know.
paper?
Who needs toilet paper?
Yeah, who would have thought?
Mhm.
But, you know, I mean, who needs those resources? And I think
Mhm.
that, first of all, I think any business owner, not just medical, not just
Mhm.
doctors, but I think any business owner, especially those that have been in their community for a while, I think we have an obligation. Again, I think we
Mhm.
have a responsibility to be there for, our entire community.
Mhm.
I just think that doctors and nurses are in such a, oh, I don't even want to know. I don't even know how to say it. I mean, they're so needed right now in so
Right.
many ways,
Mhm.
but they are also in a very, they're in a very strong position to really help people.
Right.
And help them understand what's going on, and help them grasp it without fear and panic being the message that they receive.
Right.
Yeah.
Yeah. And one of the things that they, and you know, we've kind of alluded to this, but it's, you know, when they're dealing with their staff, it's, you know, it's what can we do to help you? You know, and not, because, you know, I've worked in a medical, you know, I've worked with several different medical practices before where you had the doctor who was God. You know, you never went to them, you never bothered them, you never did anything. And then you had the doctors who were one of us, you know, and you know, I don't want the doctor that's up here that, you know, still has toilet paper and has food delivered, you know, and all sorts of stuff. I want the doctor that is also having to figure out, oh my gosh, how, you know, how am I getting my kids, you know, homeschooled? And, you know, I don't really need to know that their Mercedes is having trouble, but, you know, what if they have car trouble too? Oh, for some reason you muted your mic.
Oh, sorry.
Oh, there we go. Okay.
I hit the wrong button.
That's okay. That's okay. You know, and so I think that's a big part of, and again, it's, you know, it doesn't matter what you are, but as that business owner, you need to have empathy for the people that are working for you, you know, and not just you either work or you don't, or, you know, all those various things.
Right. And like I said, I think that the doctors can do a lot in helping their staff, keep them busy.
Right.
For starters, keep them working if you can. I think that's one of the biggest things that's going to help in the end, because there are very few things that are harder than to train a medical staff.
Right.
So if you have good medical staff, keep them. Do everything you can to keep them busy. I think taking advantage of the current government plans, there's, you know, the Paycheck Protection Plan, and there's all these different 7A loans that you can get through the SBA. They need to be looking at those resources so that they can keep their team employed and keep their economic strength going, so that they're there when the doctor needs to call them back if they're not working full time. I'll be honest with you, I know very few practices right now that I would say out of all of our clients, maybe 15% are reducing their hours. Maybe 5 to 10% are closing the door because of other extreme situations, like maybe the doctor's own health, those kinds of things.
Well, and there are somewhere they're in a building where the building
closed.
has said, we're closing down.
Yeah, that's it. We're done. So I think but there's still, I mean, even there, you know, this new government, the CMS mandate that just came out, they're allowing hotels, they're calling it hospitals without walls. Is you know, how, you know, you have doctors without borders, but now you have hospitals without walls. And so they're allowing people to open up medical facilities in places that you normally wouldn't: dormitories, hotels, ambulances, ambulatory care, people being able to go out and you know, go to the curb, get your medical care. So I think that if our doctors are wise right now, one of the best things they can do is keep their staff, for the private physicians, keep their staff busy. For the ones that are at the hospitals, is making sure they're obviously doing everything they can. I feel our nurses and stuff that are at the hospitals,
that are just working, you know, 28 hours a day. I mean,
the doctors and the nurses at the hospitals, my heart just bleeds for them right now, and they're exhausted, they're tired. In Michigan here, I know they're saying that we're not going to see the peak of this issue until the end of April in West Michigan. It's going to hit the east side of the state. I think they said mid-April, but the west side, it's not going to hit us until the end of April. So that's a long way. That's a long time to go where your staff is going to feel that kind of burnout. Now, hopefully, as this becomes a temporary new normal, hopefully we can get on top of some of that, and we're not exhausting our resources like we are currently. But yeah, so the doctor taking care of their staff is probably one of the biggest things. What they can do for their staff, making supplies. You know, I have some doctors who are sending their staff gift cards, DoorDash, Grubhub, you know, some of those things. Do those things for your staff and for their family, because they're exhausted. So there are things that the doctors can be doing to take care of their team.
You know, and then we do need to be thinking about the future. I mean,
Yeah.
there are some people who have said, this is going to come back in the fall.
Yeah.
Or, maybe it doesn't come back for years, or maybe it's a totally different thing. I mean, we've certainly had pandemics through the years that have come and have gone. So, what steps are you taking to make sure that this doesn't happen again? Or if it does, how do you deal with it? I was talking to somebody the other day. They said, they weren't exactly sure who to talk to about, their, who to pay their mortgage to. I mean,
Right.
because they just would send a check off. Well, what if they needed to talk to a person? And so things like that, and or simple things, who does your office supplies, who does your insurance, all of these various things. And a lot of times as that business owner, as that manager, you don't know those things because you have, you have somebody else who takes care, that's one of the perks. You have somebody who does that for you. Well, you still need to know those things, because what if that person all of a sudden can't fulfill that role?
Yeah.
I remember several years ago when I got very, very sick, and it was sudden. I mean, it was, oh my gosh, fine one day, not the next day. I pay all of our bills. That's great. That's fun. However, my computer is password protected. And, it was like, well, then what do you do? And so just simple things like that, where somebody needs to know how you do these things. I was talking to a business owner the other day who said, well, people still had access to the building because it was all a card key type of thing.
Yeah.
And I thought, well, what if that doesn't work? Does anybody know what to do if that doesn't work?
Like our building is password. My staff's building is password protected, and I actually had to follow a mandate. And I actually had to turn their key cards off.
Right.
And luckily, we're one of the few suites in the whole building that has a back door. So I have a key. I have a physical key.
Right.
But I'm like, what do you do if you are not just the doctor's office or whatever, but any business where you're getting that kind of restriction? And what kind of damages could you potentially walk into? One of the suites in our building, the pipe burst.
Oof.
So what happens if you're shut down and 3 weeks from now you come back and water's been running for
Or you had an employee who was on vacation and they had stuff that they needed to get out. I mean, there are times where you have to get stuff out. I did see a funny cartoon on Facebook the other day where it was this poor pathetic little plant, and it said, your office plants are regretting this. And I thought, that's probably true. But simple things now, like if you have had a space that's been closed down for a month, a school, an office, or whatever, you're going to go back in and there's going to be things growing in the refrigerator. All sorts of things that are going to need to be taken care of before you can get back to doing business.
Right. So do they have a plan? So that was one of the questions you and I were talking about, is do they have a plan for what this looks like when they go back? And right now they should, and this is something that we're hearing across the news for all business owners, and that is, what are they doing to prepare for this if it should hit again in the fall?
Right.
Or say we get, they say, okay, it looks like we're going to have we're going to lighten things up for a week or two, and then all of a sudden they can't do it again, and they have to put us back under restrictions. So if you're given
because we all just go berserk, and we all, everybody goes out.
Every restaurant, movie theater, everything is packed. But so what are they doing now? So if you were given a week, and I mean, that's one of those things that I would ask any business owners, if you were given a week where you could go back to business as normal, but you knew after a week that this was going to happen again, what would you do?
Right.
If you had 1 week, not a month, not 6 months, you had 1 week, and that really helps you identify your priorities as a business owner.
Oh yeah, your passwords, your keys. I mean, all of those various things.
Yeah, you start really thinking about, okay, oh my gosh, here's the list. So are you making a list right now? That's a simple, easy thing. Are you making a list of what you can or cannot change? if you were given a week. And what if it's
Right.
not a week? What if it's
Right.
one day?
You
Like,
know,
what if it's one day?
right. And I think many people are probably discovering that the key employees were not who they thought they were.
Yeah.
For a
Yeah.
variety of reasons. I for a while, one of the businesses that I did was kind of crisis management planning. And
Right.
so that was one of the things we said was, okay, if your business shuts down for a month, what happens? And so there's this whole group of people, and they said, well, that's okay. We're not critical, yada, yada, yada. Okay, fine. And then one of them said,
Sorry, I just think that's kind of funny for a minute. I'm thinking,
we're not important. Okay, you probably shouldn't be saying that, especially to the people who are paying your bills. But then one of them said, there is that report that we have to file. And I went, report? There's a report you have to file? And they said, oh yeah, on the last day of every month, we have to file a report with, government entity. And I said, what happens if that report doesn't get filed? And they said, oh, they close us down. And I went, okay, that would be a critical task. So who knows how to do it? Who has the authority? I mean, can anybody file it? Or, all these various things. And so that was one of those things, again, who pays the bills? When do they have to be paid? All of those things that, and back to dealing with patients. I mean, are there patients that are seen on a regular basis? What happens if you've messed that up? And and
Medicare patients, there's a very specific things like
Oh,
that they get to have done once every 90 days or something like that. So I mean, the doctors definitely have to be thinking about things like that.
Right. And now it might actually mean that they're referring them to somebody else.
Right.
But, and if that is the case, who are you referring to? I mean, do you have a trusted physician partner, who you're going to refer to? And then of course you've got the rural areas. We were talking before the program that I grew up in a very remote part of Colorado, where the closest medical doctor is 65 miles away in a different state. They're in Wyoming. Now there are some that are, same distance in Colorado, but I mean, the closest doctor is 65 miles away. So, what do you do when you have to deal with situations like that? And when things go back to normal, everybody's going to flood. It's like, okay, well, we haven't been able to do X. So it is going to be things like, okay, well, every woman is going to say, I haven't had my annual physical. All of these things. And so how are you going to deal with, oh my gosh, all of a sudden we've got all these people calling us?
Right. Exactly. I think it's going to be a big deal. I think the doctors who are smart now, the businesses, not just doctors, businesses who are smart now and really start thinking, I hate the term outside the box because I think it's overused. But in reality, the simple fact is if you have to think outside the lines right now, and if you do that, and if you're smart about it, I think from a business standpoint, people, I think they're going to be surprised at what kind of businesses they can build when this is done.
Right.
Or even even while it's happening, for that matter.
Right. And it is about communicating with them. Do you have ways that you can email all of your patients? I got an email from my doctor's office the other day and was just dumbfounded. I had no idea that somewhere I'd given them my email.
Probably on the intake form, but
it was on there somewhere, and they put it in their system. But now would be a great time for them to be sending me once every 2 week email, whatever. And obviously it depends on the type of practice and all those various things, but just reminding me that they exist.
Yeah. Well, and text messages. You'd be shocked at the number of text messages our doctors send out. Hey, you were recently seen in the office for this, just checking in, making sure you're okay. And that's huge. That's it. That top of mind marketing. So,
and reminding them that, we're still here for you, and because it was like we were saying, there are so many things now that people are thinking aren't critical, aren't urgent, actually could be.
They could turn into it very quickly. Yes.
And
I agree.
And so, that is something where depending on, and my guess is with pretty much any type of medical practice, you've got a little group of people that, they could go south really fast.
Oh yeah, yeah.
You know, and
Well, I mean, think about it this way. Even like I say, an ingrown toenail
Mhm.
for a podiatrist.
Right. Oh yeah.
It
I mean,
doesn't
you could
sound
get
like
an
that big a
infection.
deal.
Mhm.
Yeah, it doesn't sound
Yeah.
like that big a deal. But you know what? If that goes on for too
Mhm.
long, say it takes a month and the
Right.
patient tries to treat it with,
Mhm.
Epsom
With
salts
uh-huh.
and
Uh-huh.
there's a
Yeah.
lot of
Yeah. I mean,
home
they could
remedies that
yeah.
Dr. Google recommends, right?
Oh
But
yeah, good old
say,
Dr. Google.
yeah,
But yeah, I
but
mean,
I mean, just
they could get a critical infection.
right. And what's going to happen if
Mhm.
that goes on for a month? So
Mhm.
people definitely need to be reaching
Mhm.
out. They need to be talking to their
Mhm.
clients, their patients. It's critical. I mean,
Mhm.
we're calling every single one of our
Mhm.
clients and asking them, especially in the medical
Mhm.
fields, what are you doing?
Mhm.
How are you staying in touch with your patients? Because I
Right.
think it's going to be that critical.
Mhm. Yeah. And again, it's not trying to take advantage of the situation.
Oh, no,
Because
no,
we
no.
we as consumers sniff that out really fast.
Yeah,
And we don't like it. And it doesn't matter what
no,
it
of
is.
course.
Whether it's medical or anything. It's like, nah, don't you try and take advantage of the situation.
Right.
And we're
No, no,
seeing ads and things like that now, where
it is
somebody
kind of weird.
oh yeah, and
I don't,
immediately, right? The radar goes off, and you're like, what?
yeah, yeah.
And
It's
but
weird
yeah,
though when you see those things. It just
hmm
shocks me. I
yeah,
see those things, and as a
hmm
marketing person, and I know you understand this, as
hmm
a marketing person, you think, oh,
yeah.
that's
Who approved
terrible.
that? Who on earth approved that?
Yeah,
Yeah, yeah. And sometimes it's a matter of it got approved long time ago, all these various things, or sometimes it did just get forgotten, and it's like,
yeah,
oh
yeah.
my
It was
gosh.
something
Yeah.
pre-planned, and you're
hmm
thinking, oh,
Yeah,
that
we
was
forgot
bad.
that we were going to run that, and
Yeah,
so, but yeah, it's one of those things where it's like, oh dear, but again, it just goes to show that as the business owner, as the whoever in charge, you need to know what's going on. Is there a big
yeah.
direct mail piece that's planned? Okay, what is that big
Hmm.
direct mail piece saying to people? Is
Right.
it, and are you going to be 100% predicting the future? No. I was having a conversation with somebody, just yesterday, where she was saying something about, we did such and such, and 99% of the people liked it, and one person. And I said, that's the person that no matter what, they're going to complain. And
Right.
so
There's
you
always going to be
try to
somebody.
make them happy, but you just know they need
Yeah.
to complain. But it's the 99% of the people that you need to try to help.
Right. Exactly. Absolutely.
So, well, oh my gosh, Lorie, we have been talking already almost for an hour. So tell people a little bit more just about what your practice does and how you help people.
Yeah. So we have two different marketing agencies. One is very, like I said, virtual marketing director services.
Mhm.
That one's kind of my baby. You always have those babies, but
Right.
that one's
Hmm.
my
Hmm.
baby. And we focus on that particular one. We really do focus on the medical industries, medical niches.
Okay.
So working with doctors, physical therapists,
Hmm.
different types of specialties and
Hmm.
doctors,
Hmm.
healthcare markets, even working with some hospitals and their marketing departments, helping them.
Hmm.
We in both agencies, my other agency is more towards local business, smaller
Hmm.
businesses. We do have some nonprofits in there as well. And I think if anybody were to ask me, what's different from you guys, and that is the volume
Hmm.
of effort we put into it. We are not your typical marketing agency. For instance, my COO we actually will travel to our clients and evaluate, even though, I
Hmm.
mean, we're across the nation
Hmm.
and in Canada even, and we'll travel to our clients
Nice.
and see them and walk them, say, okay, let's walk through not just
Hmm.
what we can do for you
Hmm.
digitally, but
Hmm.
let's walk through everything you've got.
Great.
And in some cases, we're helping them, interview employees
Mm.
that could help with their
Hmm.
marketing. So
Hmm.
we're a little bit different. When people say full service, I always kind of laugh
Yeah,
because to me, there's
everybody
a difference
defines it
between full
differently.
service.
Hmm.
Yeah, I mean, I'm like, for me, full service means you're going to show up and be there and be in my face, and
Hmm.
and you're going to be working with me hand in hand, and
Hmm.
I don't have to just call you. On times I can actually sit across the table from you.
Hmm.
And so I think that's what we do. But yeah,
Hmm.
so that's my agency in a
Great.
nutshell, and great team of people that
Hmm.
work for me.
I love it.
So
Well, and obviously, you know, the federal laws and things like that,
Yeah.
you know, the good old HIPAA guidelines and, you know, all of those various
yeah.
things. And so that's what I like, because, you know, anybody can do marketing. And of course, I'm saying that very much tongue in cheek. But, you know, because you guys specialize in working with medical practitioners, you know what you can and can't say.
Oh, yeah.
And it's just like we were saying before, you keep up on those things, you know, as
Oh, yeah.
things change, as, you know, there are going to be things like you know, we're never going to be able to release patient information. I mean, you know, that's
right.
kind of knows, but,
PHI, right.
right. But, you know, you can refer to things differently. You can advertise. I mean, you know, there are certainly times where people have said, well, you know, with a variety of different industries and professions, there's no advertising allowed and things. You guys know those rules and those guidelines. And so that's what I like about this.
Yeah, we do. We keep up on it. You know, like I said, just this morning, I probably, obviously we have our legal counsel, but just this morning, I probably got 8 different emails from them saying, you know, and all they do is work with healthcare providers. Right. And so they're like, are you aware of this? Are you aware of that? And so they're keeping up with us. We're keeping up with them. And that's just really nice. It is really reassuring when I can get on the phone with a client and a doctor, and they're concerned about what can't I say, what can or can my message not be. I can actually speak to that and be very confident in it. So that is really nice.
Yeah, and it's important from their perspective because they're doing something else. They don't want to have to worry about what they can and cannot say. They want to, you know, they want to work with who does. I mean, you know, it's like when I go to the doctor, I want to know that they can cure that ingrown toenail.
Right. I mean, you want them to be a doctor. You don't want them to be the person who's spending hours reading articles from the federal government.
Oh yeah. So cool.
Yeah.
Well, tell us how people find you and connect with you online.
Right. So they can get to us through a couple of different ways. They can go to either website. One is mycpsolutions.com. So it's my, and then it's C as in cat, P as in Paul, solutions.com.
Okay.
Or they can go to our other one, which is vmdservices.com, which is virtual marketing director services.com. Or they can reach out to me directly. And I mean, the best way to reach out to me directly is Lorie at vmdservices.com or Lorie at mycpsolutions.com.
Perfect.
Super
I love
easy.
it. You know, and like we were saying, you can work with people, you know, throughout the United States and Canada. We do have, you know, people from around the world, so not so much, but you know, here if you're in the US or Canada, so great.
And we have worked with doctors in Australia as well.
Oh, okay, perfect. I love it.
Yeah.
Well, do you have any final thoughts that you want to share with everybody?
You know, you had asked me earlier. You had asked me, you know, to give you a quote, and I think one of the best things I could say, if somebody were to ever quote me, especially right now, in the time that we're at, what do I constantly say to people? It's like, you know what? You've got to view life in the most dynamic way possible. Stay fluid, stay positive, and always look for true north.
I love it.
That's kind of what I would go with.
Perfect. I love it. Well, I'm Deb Creer. I've been having an absolutely delightful time talking with Lorie Hibma. And until next time, everyone have a great day.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.